Module overview. This module delves into the origin, structure, and long-term consequences of adverse childhood experiences and developmental trauma. ASs are critical because they have a cumulative, compounding effect on a child's physical, emotional, cognitive, social, and behavioral development. Understanding ASs is foundational to trauma-informed care, allowing professionals to shift from a reactive approach to a proactive, preventive, and healing-centered model. This module supports standards from leading authorities in trauma research and clinical care such as CDC-Kaiser as a study framework, National Child Traumatic Stress Network (NCTSN), Center on the Developing Child at Harvard University, American Academy of Pediatrics (AP), UHO Public Health Model for Early Childhood Adversity. What are ASs? Adverse childhood experiences are potentially traumatic events that occur in childhood before age 18. The original CDC-Kaiser Permanente as study identified major types of adversity grouped into 3 categories. A. Abuse. Physical abuse. Emotional abuse. Sexual abuse. B. Neglect. Physical neglect. Emotional neglect. Household dysfunction. Witnessing domestic violence. Substance abuse in the household. Mental illness in the household. Parental separation and divorce. Incarceration of a household member. These experiences are common. Studies show 64% of people have at least one AS. Moja in 6 people have 4 or more ASs. Developmental trauma. Developmental trauma refers to exposure to repeated or ongoing traumatic experience during critical stages of childhood development. Unlike a single incident trauma, developmental trauma disrupts attachment formation, brain development, emotional regulation, language and cognition, behavior and socialization. Children with developmental trauma often display aggression, attention deficits, social withdrawal, delays in language and learning, chronic health issues. They might be misdiagnosed with ADHD or learning disorders without recognition of underlying trauma. The AS score and risk stratification. An AS score is the total number of AS categories experienced before age 18. The higher the score, the higher the risk for mental health issues, depression, PTSD, suicide attempts, substance use, physical health problems, heart disease, diabetes, stroke, obesity, cancer, behavioral problems, violence, early pregnancy, smoking and alcohol use, school dropout, unemployment. An AS score of 4 or more increases. Suicide risk B 1200%. Alcoholism risk B 700%. Chronic lung disease B 390%. The neurodevelopmental impact of ASs. Early trauma affects brain structure and function. Studies using neuroimaging show amygdala becomes overactive, fear, anxiety. Hippocampus shrinks, memory, learning. Prefrontal cortex underfunctions, impulse control, logic. ASs alter neural pathways, hormone regulation, and immune system functioning. This creates a heightened effect, flight, freeze a response, even in non-threatening situations. The as pyramid and lifelong consequences. The as pyramid helps professionals understand how childhood trauma leads to disability and early death. Moja, adverse childhood experiences. Mbili, disrupted neurodevelopment. Tatu, social, emotional, and cognitive impairment. Nne, risky behaviors. Tano, disability, social problems. Sita, early death. This model stresses the importance of early intervention and prevention, especially during the first 30 years of life when the brain is most plastic and responsive to caregiving. Trauma-informed responses to HIAS. Working with people who have HIAS scores requires non-judgmental, strengths-based, and empathic care. Some best practices include a screening for HIAS during assessments, avoiding re-traumatization, avoiding invasive or confrontational questions, building safety and trust, recognizing resilience. Protective relationships can buffer the effects of HIAS. Using relational approaches focus on consistency, empathy, and predictability. Collaborating with families help caregivers become sources of healing. Protective factors against HIAS. Although HIAS are harmful, resilience and protective factors can mitigate their effects. A stable relationship with at least one caring adult. Safe school and community environment. Positive peer relationships. Access to healthcare and support service. Emotional literacy and self-regulation skills. Trauma-informed care is not just about recognizing trauma, but promoting healing and resilience at every level of interaction.